I was told that both knees were bone on bone, and I've been watching stem cell from like 10 years when I was done with an IV.
Okay.
And that was something I didn't want, but I kept watching it. And I got a card in the mail one day from your clinic, or actually my husband did, and I went to the workshop.
Okay.
And learned about what you guys had to offer.
Okay. And before our clinic, had anybody else said what you should do, or should you get surgery?
Yes, I was told that I would need to have both knees replaced.
Okay.
That both were bone on bone, and I went through, at one time they cleaned it all out.
Gotcha.
At another time, for a couple of years, they were injecting
Cortisone,
and then they also injected, they called it chicken fat. It wasn't really chicken fat, but it was
the rooster comb.
Rooster comb.
Okay.
And it really didn't help.
Okay. So you went through a regenerative medicine program.
Right.
You had an injection in just your right knee.
Just in my right knee.
Okay. So what did you notice change afterwards?
Actually, I noticed within a couple weeks I was able to walk without pain, and I kept walking more and more and more with it, not doing jumping jacks or anything to put pressure on it, but just walking.
Great.
And all of a sudden, the left knee wasn't hurting at all.
Great.
And the right knee was the worst one. That's why I decided to get the injection on that one.
On the right knee, okay.
But it took care of the left one completely. Right knee, I'd say, is about 90% better. We were on vacation in March. I had a few days that I was actually walking 10,000 steps.
Wow, awesome.
And now I'm averaging between 7 and 10, where before I couldn't even walk across my house and I wanted to cry.
Great.
I'm excited about it. I'm very excited, and I tell a lot of people about it.
So worth it for you?
Yes. As far as I'm concerned, yeah, it was a success.